are in listen-only mode.
Hello and welcome to the County Health Rankings Data 201 webinar with an in-depth tour of the data tools on our website. My name is Amanda Jovok and I'm the data lead for the County Health Rankings, and I'm joined by my colleague Karen Odegaard.
Hello, I will be introducing the County Health Rankings and Roadmaps program and helping to answer your questions throughout today's webinar. Thanks so much.
First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Foundation and the University of Wisconsin Population Health Institute. Thanks to the support of the Robert Wood Johnson Foundation, we currently have 3 community coaches in the County Health Rankings and Roadmaps program, and our assistance is no cost to you. Please don't hesitate to contact us if you need assistance with a tool, a question, or a next step in your process. You'll find this orange box throughout the website so you can send us an email.
We want to take a moment to get you oriented to the technology that we'll be using today. The GoToWebinar attendee interface is made up of 2 parts. On the left, you can see the viewer window where you will see our screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. We will be taking questions via the control panel. As questions pertain to the content that we're covering, we may pause along the way to answer those questions. There will also be time for Q&A toward the end of the webinar. As we go throughout the webinar today, if you have an idea or a thought, a tool or an example, please feel free to enter these in the chat box and we'll make every effort to share them with others on the call. So here's a look at what we're going to be talking about today. We'll start with an overview of the County Health Rankings and Roadmaps program. Then we'll demonstrate how you can use our site to explore the rankings data. After that, we'll check out a couple of data tools available on the website. We'll look at using the rankings data and measuring progress. We're going to cover using the rankings data in some depth. Throughout the webinar, we'll head over to countyhealthrankings.org to see how the site functions so that you will walk away from today's webinar able to confidently navigate the site. We like to start our webinars with an essential question for you to hold in your mind throughout the presentation. That question today is, how can the County Health Rankings and Roadmaps help us understand and find data for our community? We also like to encourage you to be thinking about who else you need to share this information with, one new area of the website that you will use or explore, and what else you need to know to take action and to use this information. So let's start by reviewing a little bit about the County Health Rankings. We'll take a look at the thinking behind the rankings. The rankings start with population-based data from a variety of sources. We use that data to rank the health of nearly every county in every state. Each year, the rankings release generates a lot of national, regional, and even local media attention. Community leaders use the rankings release to get the word out about their community and to generate local media. They can use the rankings findings as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. Based on a deeper look at their community's unique priorities, communities then can identify the evidence-informed strategies that they can implement locally. Over time, these evidence-informed strategies ultimately result in longer, higher quality lives for the children and adults in the community. Essentially, the County Health Rankings aren't about numbers so much as being a call to action. The horizontal portion of this picture underpins the rankings. The County Health Rankings shows us that where we live matters to our health and that a broad range of factors impact how long and how well we live. The vertical portion underpins the roadmaps, which offer communities guidance, tools, and resources to move from awareness to action to create healthier places to live, learn, work, and play. This graphic shows our theory of change about how the rankings can be a catalyst for action that improves the health of everyone in a community. So let's take a little deeper look at the rankings part of this picture. This is one of the most important images that we share with communities. It shows what we use to determine the county health rankings and what influences health in the community. This model shows the relationship between policy, health factors, and health outcomes. It illustrates how multiple factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, availability of jobs, our social connectedness, all of these things impact our health outcomes. So starting from the bottom, we know that from research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes to show how healthy each county is: the length of life and the quality of life. Much of what affects our health happens beyond medical care, and this model and the rankings underscore how important it is to build a culture of health, where getting healthy, staying healthy, and making sure that our kids grow up healthy are top priorities. I'm going to turn the presentation back to Amanda now.
Hi there. Having looked at the model, now we're going to turn our attention to the website, countyhealthrankings.org. The first segment of our web tour will focus on introducing you to some key navigation tips and exploring the rankings data. You can find information for your state and county by either entering your county or state name in the drop-down menu from the Rankings tab or by clicking on your state on the map found on the home page. If you click on your state on the map, this is where you'll find yourself. This year we introduced a landing page for each state. On this page you'll find many helpful resources. On the top of the page you'll see the health outcomes map on the left and the health factors map on the right. Both maps show how Wisconsin's 72 counties compare to each other. We think of health outcomes as today's health, including the length of life and the quality of life. We think of health factors as tomorrow's health, including health behaviors, clinical care, social and economic factors, and the physical environment. The lightest shade counties in this map are healthier, and the darker shaded counties are less healthy. To get to your county's data, you can click on your county on the map. We'll come back to this in a bit. On the bottom half of each state page, you'll find a variety of tools and resources. You'll find state-specific data downloads for the current year, additional state-specific data resources, stories from your state, resources for community health improvement specific to your state contact, and a link to our Action Center to guide your community in improving health. We'll now take a look at a specific county snapshot and describe the information available there. Let's say we clicked on Dane County on the map. In the snapshot that comes up, you'll see it ranks 17th out of 72 counties for health outcomes and 2nd for health factors. Not the best in the state, but in the top quartile. Let's walk through the type of data you'll find in your county snapshot. In the first column, you'll find our measures. We have 34 measures. Because this is a screenshot, you'll only see a portion of the snapshot here. 2 overall ranks: health outcomes, today's health, and health factors, again, tomorrow's health. You'll also find ranks for each health outcome and health factor in this far column. Your snapshot contains 4 columns of data. First, you'll find your county data. Here we see data specific to Dane County, Wisconsin. Next, you'll see a trend column, which we'll come back to in just a moment. In the next column, you'll see the error margin. We use a 95% confidence interval. Basically, this means that we are 95% sure the actual number for your county is in the given range. In the fourth column, you'll find top U.S. performers. It's included as an aspirational value. Only 10 counties in the nation do better than this given number. Finally, you'll see your state column. This allows you to compare your county's numbers to your state overall. Let's go back to the trend column now. For each of the measures where sufficient trend data is available, you can view a detailed graph of the trend data by clicking on the graph icons. We've color-coded each icon to help you quickly see whether your county's estimate is increasing, decreasing, or staying the same over time. Red graph icons indicate your county is getting worse for this measure. Yellow indicates your county is staying the same for this measure. Green indicates your county is getting better for this measure. Let's take a look at the trend graph for adult obesity in Dane County, Wisconsin. You'll see your county's trend in orange, your state's trend in green, and the national trend in blue. You can see here that Dane County is getting slightly worse for this measure. Next, we're going to look at areas to explore. Areas to explore highlight potential challenges a community may want to examine more closely. When you turn this feature on, orange boxes will highlight areas to explore based on health factor measures that seem to have the greatest potential opportunity for improvement based on the following. Measures where there are meaningful differences between a county's value and the state average, or the top U.S. performers, or the state average in the best state. Comparison values differ between measures. As with county ranks, these areas to explore are just one starting point to consider in the journey toward improving health in your community. Here we can see that Dane County may want to look at additional national, state, and local data related to adult smoking, adult obesity, and excessive drinking to determine if these are areas on which to focus their efforts. So now we're going to go into a little more detail on the data tools available on the County Health Rankings website. These are the tools we're going to examine more closely in this webinar, but first I'd like to get a sense of which of these tools you've already used.
So we're going to launch a quick poll to have you share with us which tools you've used among the data tools on the website or on the screen right now. We call these our rapid response polls just so we can get a quick sense of our audience and what you're familiar with on our site. Take a look at that. So we'd like to wait until we've got about 70% of you voting, so we'll just give you a little bit of time to share with us again which of the tools you might have been to. As Amanda said, we'll be going through each of these tools in a little bit of detail today, some a little bit more than others, so we'll take a look at these as we go. All right, that's great. Thank you so much for participating in the poll. We're going to go ahead and close this right now, and we'll share the results so you can get a sense of what kinds of tools you've been using.
So this is really interesting. We're going to be going into some depth in the using the rankings data today, so hopefully I'll be introducing some new ways to use that section, and we're going to go pretty deep into the measure detail pages as well, so that should be an introduction for you guys.
For those of you who have used using the rankings data, the measure detail pages, do feel free to chime in and let us know what about them has been particularly useful for you, how you've used them in your community, and share those kinds of stories with us. Those tips can be helpful to others on the call as well to think about how they might put these tools to use in their community.
Okay, so now we're going to go take a live walk through the website to look at the measure detail pages, downloads, and comparing counties. We're going to start from our home page, and once again, I'm going to take us to Dane County Snapshot. Actually, Karen is, so I'll be kind of driving her through the website. We're going to start with some of our measure detail pages. You can learn more. Oh, I'll let this load up here. So this is the Dane County Snapshot, okay? You can learn more about each of our measures by clicking on the Measures tab. So you can see there's these tabs at the top of the page, or by clicking on the measure name from the snapshot. I'm going to click on a measure from the snapshot. We're going to look at adult obesity. So let's look into this measure. So once we click on adult obesity, it's going to bring us to the measure detail page. Once again, You saw that we progressed along the tabs at the top to the Measures tab, and now we have a new set of tabs specific to the Measure Detail page: Map, Data, Description, Data Source, and Policies. Each measure within a state has a page dedicated to it with lots of information. So first you can see the map, which groups the counties according to how well they perform on this measure. Counties with less obesity show up lighter than counties with more obesity. We don't provide ranks for individual measures, as there is often substantial uncertainty associated with a single measure. However, these maps can give communities a visual guide to whether their community is among the best or the worst for a given measure. Along the left-hand side of the page is substantial information about each measure. First, there's a short description of the measure. In the Rankings Methodology section, you can see which section of the model this measure falls within, in this case, health behaviors. You can also see the weight of each measure within the summary rank, and you can see the years of data the measure represents. It's important to remember that although we release data annually and always use the most current data available, each measure can come from quite different years. For example, in the 2014 release of the County Health Rankings, the data for unemployment came from 2012, and the data for low birth rate was combined data from 2005 through 2011. The summary information box includes the range of the measure within your state from the lowest county to the highest, the overall rate in your state, and the top U.S. performers, which again is the value for which only 10% of the counties perform better. The next tab contains the data table. Each measure's data table will look slightly different depending on what data we have available and feel is useful to communities. In each table, we try to include either a numerator or a denominator, the estimate, a link to the trend graph if available, and error estimates if available, and the z-score if it's a ranked measure. The measure description includes a more detailed description of each measure, as well as a short summary of why we include this measure and a short discussion of the strengths and limitations of each measure. In the Data Source tab, you can read a brief description of the data source used to gather the estimates, as well as a link to download the data yourself if available, and a link to the methodology used by the data source. For health factors, as opposed to health outcomes, there's an additional fifth page, Policies. On this page, you can see the policies listed in the What Works for Health database that relate to the measure you are exploring. What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and system changes that will improve the variety of factors we know to affect health. Okay, so we're going to go back up to the top of the row tabs, and we're going to click on Downloads. Within the Downloads tab, you'll find state-specific downloads from each year of the rankings. For each year, you can find a summary report, an Excel data file, and two maps, one of the health outcome ranks and one of the health factor ranks. The Compare Counties tab, which is the next tab on the top. Okay, so this tab allows you to quickly and easily select a number of counties in your state to compare. For each county selected, you'll be able to see the values for all measures available and the ranks. You can then print off these comparisons for easy study. Our website doesn't currently allow comparisons between counties in different states. This is due to the fact that some measures are collected slightly differently in different states. However, we're hoping to build functionality that allows a subset of measures to be compared between states in the future. You can see that Karen quickly added 3 counties. You can add as many counties look good in your browser, so there's no particular limit to the number of counties you can add. Okay, now we're going to go back up to the Rankings drop-down menu and find in the Rankings drop-down menu, we're going to go to the Download Rankings Data, because I'd like to show you in some greater detail the national downloads that are available on the site. So we're moving away from the measure detail pages at this point and moving into other areas of the website. Every year we've made a national Excel file available that's similar to the state-specific Excel files but contains data for every state. This year we have several new options for downloading data. You can download the 2014 data, rankings data, as an analytic file, one that's structured more easily for data analysis. We've made this data available as either a SAS or a CSV file. There's also a documentation file that functions as a codebook. You can also download all the data we use to construct the trend graphs in a separate file. They are also available as SAS or CSV formats. I'll note here that one reason we're releasing this file is that in some cases, when the data source that provides us with the data has retroactively updated their data, the trend data won't necessarily exactly match the data that was used in prior years of the rankings. There's documentation that explains this available as well. Okay, we're going to move to one other area of the rankings website called Using Your Rankings Data. Okay, here we are, and you can see that this tool has 4 sections: exploring the data, making use of your snapshot, digging deeper, and finding more data. Exploring the data is an introduction to your snapshot and the measure detail pages that's very similar to the tour we've just provided on this webinar. You can go to that section to remind yourself of all the resources available. So you can see it kind of walks you through the pieces of your snapshot. Making use of your snapshot, the next section in the Using the Rankings data, is about making comparison to other geographic areas, focusing on important measures, and examining trends. I'm now going to return to the PowerPoint slides and introduce an example county here to walk us through this section and the rest of the Using the Rankings data tool. Okay. So, Guilford County, North Carolina is an urban county that I recently worked with to help them interpret their snapshot. I'll take us through some of the steps outlined in Digging Deeper. I'm going to move through this somewhat quickly so we can get a sense of the whole process. I want to take us through examining a snapshot, formulating questions about that snapshot, and exploring a resource outside of the county health rankings to help answer those questions. Please note that we really appreciate any follow-up questions you have, and we'll try to address any after the presentation. Okay, so following the Digging Deeper section, first we focus on the health outcomes. We should ask ourselves, how does my county rank, and how do my county's measures compare to state averages, to the top U.S. performers? It appears that Guilford County ranks pretty high in North Carolina in both length and quality of life, ranking 14th out of 100 overall, and 15th in length of life, and 9th in quality of life. All of their measures are better than the North Carolina average, with one exception, low birth rate, where they have a rate of 9.5%. This is higher than the North Carolina average of 9.1%, and the error margins of the county estimate don't overlap with the state average. So we can have some confidence that this is a true difference. I'd also note that none of the measures used in the health outcome ranking are as good as the top performers, so we know that there's room for improvement throughout Guilford County. Okay, now we're going to take a look at the health factors. So I know this is really small, but I want you to be able to kind of look at the snapshot as a whole rather than just individual pieces. So first we can see that overall, Guilford County is doing better than most counties in North Carolina with a rank of 17 out of 100. However, this masks some important areas potentially in need of improvement. Guilford County appears to have quite high quality health care with a ranking of 12, but it's worse than average in the physical environment with a ranking of 60. Health behaviors and the social and economic environment are also not as good as their health outcome ranking at 21st and 22nd respectively. And these two areas have the most substantial impact on the overall health of communities. Earlier in the webinar, we noted that health factors can be viewed as a ranking of tomorrow's health. With lower rankings in both health behaviors and social and economic factors, Guilford County is likely to have a hard time maintaining its current high rank. Looking at health behaviors, we see a higher than average STI rate of 1,028 versus 568 for North Carolina. So in clinical care, we see that much of the advantage for Guilford County seems to come from a good supply of providers. The ratios for primary care physicians and dentists and mental health providers are all lower than the state average. Otherwise, the measures of clinical care are more or less similar to the state average. Within social and economic factors, while most indicators look good, children in single-parent households and the violent crime rate are somewhat worse than the state average. Within the physical environment, we see higher than average air pollution, severe housing problems, and higher commuting alone. So this is the kind of information we can gather from a quick look at the snapshot of Guilford County. Now, after we've done that, we want to turn on areas to explore. Okay, so you can see that smoking, obesity, STIs, unemployment, and violent crime are all highlighted. Areas to explore considers not only the comparison with the state average, but also a comparison with the national standard and the overall weight of a measure in its algorithm. Since smoking and obesity affect the health of so many Americans, most counties will need to keep these measures in focus. Unemployment was the other measure we did not focus on at first glance. While unemployment in Guilford County is only slightly above the state average, sometimes the state average is not the only comparison to consider. In this case, unemployment overall in North Carolina is high when compared with the rest of the country. Okay, the final step outlined is looking at your trend graphs. I'm going to take a quick look at the 4 trend graphs in this snapshot with a worsening trend. Adult obesity has been getting worse at around the same rate as the state and nation. For STIs, we can see that 2001 was a particularly bad year. We'll need to keep an eye on this trend in upcoming years or dig a little deeper in this data. By reading the description for the STI measure, we find that screening practices within a county can have a significant effect on the rate of reported infections, so this is something we'd want to look into. Okay. In unemployment, we can see the effect of the recession with rising unemployment throughout the state and nation between 2007 and 2010. While there has been improvement in recent years, Guilford County is still slightly worse than North Carolina as a whole. Prior to the recession, this was not the case. Also, we can see that children in poverty is worsening, similar to the state trend. So I think that based on looking at this snapshot, we might want to spend a little more time exploring unemployment, STIs, violent crime, low birth weight. I would also not ignore children in poverty, obesity, and smoking. Okay, the next section in using the rankings data is digging deeper. This section helps you probe some of the areas that you've decided to focus on. The resources in this section are primarily questions to spur your focus and maps to visualize your data. The mapping resources we link to can help you visualize the data you're examining, and in some cases can drill down to even more granular geographic areas to focus your efforts. We're going to look a little more closely at the questions that are aimed to help you focus in on the measures that you're interested in. First, we offer a series of questions that can be asked about nearly any measure in the rankings. For most measures, you might want to ask, how does this measure differ between men and women? How does this measure vary among racial or ethnic groups? How does this measure differ across age groups? And are there specific zip codes, neighborhoods, or school districts where problems with this measure are localized? We'll get back to some of these questions later. Okay, digging deeper also offers suggestions about questions you might want to ask depending on the health factor areas you're focusing. Sometimes these questions will point you to subgroups that are often at risk for the particular areas you're focusing on. Sometimes they'll point you to adjustments to our measure, little changes that might be useful to examine. Sometimes they'll point you to other indicators you might want to be looking at. The rankings make every effort to include the indicators that matter most across the country, but there may be important indicators in your community that we don't touch on. I'm just going to walk through some of these questions really quick here. For example, in health behaviors, some question you might want to consider is how many people were cited for operating while intoxicated or underage drinking. You know, this will lead you into slightly different areas than the measures that we currently have. For social and economic factors, we offer unemployment, but you might also want to ask how many people are underemployed in your county, if that's something you're thinking about focusing on. If you're interested in looking, if you see a problem maybe with the dental supply, or maybe even if you don't, you might want to ask what percentage of the population has seen a dentist in the past year. These are questions that you can oftentimes find answers to in your community. Okay, so once you have a focus on questions of interest, you'll often need to start looking outside the County Health Rankings website. In the Finding More Data section, which is the final section of the Using the Rankings Data tool, we have guidance to help you do that. We provide a list of important national sources of county data and links to state-specific lists of data sources. I'm going to give you a brief introduction to each of the national sources. The American Fact Finder is a website of the U.S. Census Bureau that organizes data from a number of their products, including the American Community Survey, the Population Estimates Program, and the Business Patterns data. We get a lot of our data from the American Fact Finder, and there is a wealth of data available for you in your counties. In fact, the American Fact Finder can provide you with some of the most granular data of any national source of data. You can often get data down to the census tract level there. CDC Wonder is a fabulous resource that provides data about mortality, cancer incidence, HIV and AIDS, vaccinations, births, and environmental data that are available for query. The Food Environment Atlas provides access to the food environment indicators and can give you a spatial overview of communities' ability to access healthy food. They not only have wonderful data, but also wonderful maps. Kids Count, produced by the Annie E. Casey Foundation, tracks a range of demographic, health, and economic data on children and families and ranks states on the well-being of children. This is a particularly useful complement to the County Health Rankings, as there aren't that many national sources of data on children, but Kids Count does a wonderful state-by-state way of gathering that data. The Health Indicators Warehouse, which is a resource of the National Center for Health Statistics and is one place to access all of the County Health Rankings data, also provides access to national, state, and community health indicators that support many different initiatives such as Healthy People 2010, the County Health Rankings, the Community Health Status Indicators, and lots of data from the Centers for Medicaid and Medicare Services. Okay, so I'd like to show you how to answer a question triggered by our examination of the Guilford County snapshot relatively quickly using one of these resources. So I noted that low birth weight seemed to be a weakness in the health outcomes of Guilford County. Perhaps we'd like to know how low birth weight rates vary by age. Is it more common among younger or older moms? CDC Wonder, as I mentioned, has tables of birth data, and we can use that to find an answer to this question. We're going to head to that website now and walk through finding a solution there. I'll be directing Karen as we gather this necessary data. Okay, so Karen's found her way from the County Health Rankings website to CDC Wonder. She's going to click on the birth data. We're going to click on natality for 2007 through 2012, the most recent birth data. Okay, we have to go scroll down and agree to all of their terms and conditions. Okay, we want to group results by age because we want to examine this data by age. So we're going to look for the age of mother. Okay, we aren't really interested in birth rates or fertility rates. We just want the total count of low birth weight births in the county. So now we're going to find the county. To do that, we have to scroll down to North Carolina. And then we click Open, and you'll see a bunch of the counties in North Carolina. Not all of the smallest counties are included, but most of the larger ones are. Okay, now we're going to scroll down, and we're going to go all the way down to selecting birth characteristics until we get to birth weight. Okay, and there we're going to select only the groups that are low birth weight. That's from 499 grams all the way up to 2499 grams. Okay, now we're going to go all the way down to the bottom of the page. So we've selected all of our characteristics, and we're just going to send it. Here we get a nice table that tells us the number of low birth weight births to mothers of different age. The problem is we don't know the total number of births, so we have to go back and get that. So let's pretend we copy this to an Excel file. Okay, we're not actually going to do that, but we'll go back to the request form now. And we're going to go back down to birth weights and select all birth weights instead of just the low birth weights. All right, and all the way down to the bottom again. And we can click Send. And you can see again another table of the age of mother and the total number of births. Okay, so we can go back to the PowerPoint, and through the magic of computers, you'll see that I've actually created a table that put them side by side in Excel, and then divided the number of low birth weight births by the number of total births. And we can see that the percentage of births that are low birth weight does vary by age, and younger mothers and older mothers are the most likely age groups to have babies with low birth weight births. So that's just one example of how you can answer questions that come up with this by using the resources we are linking to. Now we're going to move on to state-specific resources. Okay, in addition to national websites, the rankings team has compiled data sources from all 50 states that provide more information about our health factors, and many of which provide information about specific population subgroups or focus in on smaller geographic areas than counties. You can see that we, in the breakdown column, list either demographic or sub-county. It kind of tells you that either you can do specific population subgroups, or you can look at data that's smaller than the county areas to kind of guide you about what you'll find there. You can see that for North Carolina, we've included a wide variety of data sources, from communicable disease reports to public instruction data and statistics. Okay, so at this point, we've taken you through the process of exploring the different areas of a snapshot, to exploring measures in detail, to going outside of the rankings website to answer a question spurred by our data. I'd like to walk you through one more area of the rankings site that explores how you think how measuring a changing picture of your health in your community can be done. Okay, this section's called Measuring Progress. I'm going to briefly describe the Measuring Progress tool, but I won't go into great detail during this webinar. We recently did a webinar specifically on this section, and we're planning another, more detailed webinar on this topic in the coming months. So for today, we'll just touch on a few bases. Okay, many communities around the nation are working to improve their health, but how can they measure progress? There's many ways to do this, and one size may not fit all. We've included some guidance on our site to help you see if you're on the right track. Ranks are great for garnering attention, simplifying a lot of complex data, and making comparisons between one community and another at a point in time. But they shouldn't be used alone to measure a single community's progress. Rather, look at them as one tool among many. Because ranks are relative, they aren't helpful in isolation. Your county's rank depends not only on what's happening in your county, but also on what happens to all the other counties in your state. In fact, if every county in a state improved its health, their ranks would all stay the same. So look for ranks to inform your progress measurement, not drive it. Be realistic about how quickly you can move the needle. It'll take time for your efforts to improve your health outcomes. For example, when you reduce your adult smoking rate significantly, it will take some time before this positive change reduces the number of preventable deaths due to smoking. When you increase high school graduation rates, some effects will be immediate, but it'll be years before premature deaths are reduced. Also, most data collection via census or survey has lag times. For example, the county health rankings premature death rates represent a lag of more than 3 years. And to be sure that we have reliable data for communities of all sizes, we use 3 years of data. So the premature death rates you see for the current rankings reflect premature deaths from 4 to 6 years ago. Not the best for measuring current progress. Okay, we're finished with our tour of Data 201. I hope you learned something new. These are the questions we posed at the beginning of the webinar. If you'd like to share your thoughts, this is a great time as we move into Q&A.
This is also an opportunity for you to think about what are some new areas of the website that you think you'll be using or exploring. And if you want to let us know that through the question field, that's great too. We love to hear your feedback that way as well. What else do you think you need to know to be able to take action and to use this information? And who else do you want to share this information with? So do feel free to let us know your thoughts, to your answers to those questions, your thoughts based on those questions. So we have a question here about where can we find recommended timeframes for realistically measuring change for specific strategies? It's a great question.
That is a great question. That is going to depend on a whole lot of factors, including what your strategy is and what measures you've chosen as your measures to track change. I guess as a wide recommendation, I would say allow more time than you think, if you can. Measuring change can take a substantial amount of time when we're undertaking the kind of hard work that communities are taking to change health throughout their communities. So I think you have to expect that, I would say this from statistics, in order to see a trend change, you have to have a minimum of 3 data points. So if you're collecting annual data, the absolute minimum amount of time you need is 3 years. If you are really thinking about tracking trends, I would prefer to have 5 years or 5 time points of data available. That's kind of the rule we use as we're deciding whether or not to include trend graphs. We like to have preferably 5 independent data points in order to track trends, although we've gone to 4 where there's substantial years in between the data points. I hope that helps.
Thanks, Amanda. I would just throw in there also that it's helpful to think about what some of your interim measures might be that might help you understand if you're making an impact that that maybe aren't going to be those longer term things. You maybe not see again those your death rates declining from tobacco use, but can you start to measure communities or organizations that have tobacco-free policies? Can you measure the people who report being a tobacco user? So thinking about some things that you can measure in the meantime to get to those longer-term changes can help you track your progress and understand whether you're headed in the right direction and help maintain momentum for the work that you're doing in your community. So an important question here that we should note, Jacqueline is wondering if the webinar is going to be available for review or to share with colleagues, and yes, this webinar is being recorded. So that first question that we have in the reflection questions there, who else do you need to share this information with? It is easy to do because you will be able to go ahead and just share a link right to the webinar recording.
Prior to the webinar, I was looking over some questions that people sent in, and I thought there was one really good question that I get often in phone calls. It was, does local data trump national data or vice versa? And this is a great question when you're thinking about whether or not to go to state sources or national sources. And of course, like many things, there is no simple answer to this question, but I will point out a few differences. So local data oftentimes has the advantage of being more current, Oftentimes it has more respondents in the area in which you're focused, so you can get more exact estimates. Sometimes it can be conducted more inexpensively and with less lag time, so you can see change in your community faster and easier. The problem with local data is that you rarely have an excellent national comparison. The ways surveys are conducted and the ways that questions are asked and the ways that data are collected matter a lot to the estimates that we get. And so if you're tracking obesity in your community and you're not doing it the same way as the national sources of data, which is difficult to do, it's going to be difficult to find your comparison counties or your comparison to a state. So sometimes knowing that you have, a 16% low birth rate, let's just say, it's hard to put that in place if you don't have something to compare it to. So they're both really useful for their own purposes. You just need to think about what you want to get out of them.
Thanks, Amanda. A logistical or technical question here. We have provided a lot of great trend graphs and maps and tables. How easy is it to put those into presentations, to download them or to save images of those and put them into presentations? Do you have any thoughts on how that works?
Yeah, there are different ways that you can download the files. If we're talking, for example, each state's map of their quartiles of their health outcomes and health ranks are available as, I believe, PDFs in the state download section on the state pages. You can also, if you're looking to grab a trend graph, if you open one up and right-click on it, you can download it as a JPEG file. In fact, you can do that with much of our website where we have files available. A lot of tools and images are available in our Tools and Resources section on the website, so you might want to check that out. If you're looking for the model or the Take Action cycle, you can find those there. Hi there, sorry about that. I forgot to turn on my microphone. I see a question here. It says, I'm struggling with the fact that choices and changes we make now won't be relevant in the data for another 3 to 5 years. I hear you. It is really hard to wait that long for outcome data. So I will also point out, although I am generally an outcome researcher, there are lots of people, experts in fact, in measuring progress along the way. Measuring the buy-in that you're getting in your programs and your policies, measuring participation in your programs, measuring any actual implementation of policy changes. And in some cases, for some policies, if you're working with schools, for example, it's a lot easier to get data from schools. You have a population who's more contained, who's more available for tracking change in. So I don't want to say that the barrier is overwhelming, but I do think patience is often required.
Thanks, Amanda. Sarah's wondering if you can compare changes over time within a county as long as the years don't overlap, or are the trend graph measures valid in that regard?
Well, people do obviously compare year-to-year changes, and that is definitely a viable way of measuring the action you're taking, measuring change in what you're doing. It can just be difficult, especially in programs that are not implemented, say, all at once if you're implementing things over a 3-year period, your year-to-year changes can be small, and so seeing the trend over time can be a very useful way of understanding your changes. So it's not invalid. It's actually slightly more difficult statistically to get significant change in just a year-to-year basis compared to looking at several years of data, but that's always the case. The more data you have, the more power you have in your analysis. So there's nothing that's bad about just comparing change from year to year.
Okay, so I'm not seeing other questions coming in right at the moment, so let's take a look at a couple of closing notes for folks. We do have upcoming and archived webinars on our site. Amanda had mentioned that she had done a webinar a while back on measuring progress, so you can find that in our archived webinars. Our next webinar is going to be just coming up next week, next Tuesday. So hop online to countyhealthrankings.org and check out our webinars, upcoming webinars and archived webinars available there. We encourage you to stay connected with us. You can use social media. You can like us on Facebook. You can follow us on Twitter. And you can sign up for our e-newsletter. So you can reach us at chr@match.wisc.edu to subscribe to our e-newsletter. As we mentioned at the beginning of this webinar, the Rankings and Roadmaps program is the result of the contributions of many partners, and we'll end by listing them here. We are very grateful for the Robert Wood Johnson Foundation's support of this program, which allows us to bring this webinar to you, and as well as the County Health Rankings and Roadmaps program as a whole. Thank you so much. Have a great day.
Thank you.